everybody, it's Jamie here, and I thought I would do a little quick update video. This shouldn't take too long because there's not a whole lot to say. Probably about 4 or 5 days after my last video, I got the sutures out, and you can see things look pretty good. The only kind of hiccup, excuse me, was that I had a bump like right here along the incision line, and there was like something white at the top of the bump. And for a while, I just thought it was either like a pimple or like the white was like maybe dead skin. But I tried to get a really good close look at it, and it kind of looked like one of the inner sutures poking out. So I just let it be. I didn't do anything about it. And my follow-up appointment this past Thursday, and I pointed it out to the nurse who was doing my follow-up appointment, and she agreed that it was actually a suture from the inside that had just, like the little tail of it had not gotten tucked into the incision. So she trimmed it, and I guess this is kind of gross, but like a bunch of pus came out of it, so it was a little bit infected there. So since then, the bump is like almost entirely gone, so that's good. It's only been a few days since then, so that's nice. Overall, I would say things are fine with me. They're not necessarily good. They're not necessarily bad. I did figure out a way to wear the elastics on like both the TADs that I was instructed to, because if you remember in the last video, I talked about how my gums were bleeding. So I did figure out a system with that, and that's been fine. The elastics have been helping my bite. Like this is my bite right now. So it's quite a bit better than it was before the surgery. The only caveat about that is that I can put my teeth there, but that is not actually where my jaw wants to go when I'm chewing. So when I'm chewing, it's still the same thing, like only this side touches in the back, like just there's very minimal contact. So I was explaining that to the nurse at my follow-up appointment, and she was very confused by that and didn't know what to suggest. And I just kind of felt like, yeah, this is par for the course with my entire orthodontic journey. I'm just never what they expect to have happened. So she tried to get a hold of the surgeon, and she wasn't able to until after I'd left. So she gave me a call a little while later and told me that the surgeon wants me to keep wearing the elastics until November or December, and I can kind of pick. So I was like, November. So I made an appointment, and it's toward the end of November. So then hopefully I'll be getting my TADs out. That sounds like it's kind of the plan. So, and then they will suggest what to do from there. I'm still opening crooked, as you can see. And honestly, I really just feel like I probably need jaw surgery again, but I'm not an expert. I'm not a surgeon, so we'll see what they say. But taking the tumor out hasn't really changed anything to do with the bite, and the elastics haven't changed anything to do with the bite. So that seems to be not great in my opinion. So I don't know. I don't know what's going to happen. Also, I've had a lot of tightness on this side, and I was doing the aura stretch religiously, and then I kind of fell off because it's been almost 2 months now. So after I take the elastics off, after wearing them for 2 hours like I'm supposed to do, my jaw's pretty tight, but it does loosen back up. And actually, it's been good for about the past week. It hasn't been as tight as it was there for a little while. But I don't feel like I'm able to open my mouth as wide as I was before the surgery unless I really force it. So that kind of sucks, but hopefully it seems like it's getting back to what it was. So that'll be good. But yeah, other than that, things are fine. Like I'm getting back to eating most food. Like I've been having like sliced apple and stuff like that. I don't eat a whole lot of hard food to begin with just because of jaw pain when I do that. So like I don't ever really try to eat raw carrots or anything like that anymore. So I haven't done that. But everything else that I normally eat, I have been able to do, like Cliff Bars or whatever. So that's good. And I don't really have any symptoms anymore. It's still like a little bit numb, like just in this area now. And so it does tingle sometimes, which is a good thing because it means the nerves are coming back. But yeah, that's kind of about it. Just sort of, I don't know, not a whole lot to say. It's not great. It's not bad. We'll see what the surgeon does in November. So, but yeah, I have a bad feeling about it, but we'll see what happens. Everyone keeps trying to encourage me to be optimistic, but after everything I've been through, it's kind of hard to be optimistic, and especially seeing that my bite hasn't really improved except for when I'm wearing the elastics. Also the best part was that the tumor came back from the biopsy as benign. It was a synovial chondromatosis, and I guess it was a lot of like loose cartilage pieces in the synovial space of the joint. So that's good. They didn't think it was cancerous, but it's really nice to get that confirmation from the pathologist. So yeah, hopefully I'll make an appointment again toward the end of November after I go see the surgeon again, and we'll see what the next steps are. So thanks for watching, and I really appreciate all the nice comments that you guys leave for me. It always makes me feel really good when I see a nice comment there wishing me well. So thank you for that. And yeah, have a great month until I talk to you again.